In this video, I'd like to discuss pelvic infections, also known as pelvic inflammatory disease, PID for short. So pelvic inflammatory disease is a common factor for recurrent miscarriage, and it can also cause, if it's very severe and if it's left untreated, can cause some infertility problems among couples as well. So what exactly is a pelvic infection is that you develop an infection on the upper part of the reproductive tract, the female reproductive tract specifically. So what do I mean by that is that you develop a potential infection on your uterus, fallopian tubes, the ovaries, and also inside the pelvic cavity. This is where this inflammation, this infection begins, and it's usually caused by a bacterial infection. Now, this can be caused by an array of different causes. It can be caused by poor hygiene in cleaning and maintaining hygiene of your genitals, especially the external genitals. This is where the bacteria usually enters into the pelvic cavity. So bacteria is very easily being able to enter via the vagina because it's an entire tube, a tract, the reproductive tract is connected from vagina all the way into the pelvic cavity. So if you do not have proper hygiene, you may risk yourself from exposing yourself to certain bacteria. So proper hygiene is one thing that we look out for. Another thing is that if you do have multiple sexual partners, you are putting yourself at a risk of having bacterial infection within your genitals, especially if you do not use condoms as well. This is another high risk group that we look at. And then some women also tend to develop PID after going for induced abortions or certain surgical procedures of the cervix, of the uterus, the vagina. These are all some common factors as well. Of course, there are other factors as well, but the core reason behind it is that there's an introduction of external foreign bacteria into the reproductive tract causing this infection. So it can be caused by STIs and STDs, so you do need to get yourself screened regularly and prevent that infection. So because PIDs tend to develop with no symptoms at all, because that's why women only tend to realize PID when it's already far acute, far severe, and at that point symptoms include some pelvic pain, some abnormal vaginal discharge, some tenderness in the ovaries. You feel all this, and then at that point you might need some surgical approach, some medication involved as well. So diagnosis of PID is done using 4D color Doppler ultrasound and also a laparoscopic diagnosis. Sometimes we also need to do a transvaginal ultrasound to visualize the pelvic cavity. PID is commonly associated with adhesions. So these adhesions are scar tissue formed within the region. So it can be within the pelvic cavity, or it can be inside the fallopian tubes as well. This is how the infertility develops. And then it can cause swelling in the fallopian tubes, it can cause accumulation of fluids, it can cause pus, and it can cause ectopic pregnancies as well, which is why it's associated with recurrent miscarriage and infertility. So this is something that we do need to take very seriously, and treatment at Antai Hospital, of course, is that we do use a combination of antibiotics to treat the underlying infection at the root cause. Once the infection has been treated, then we need to remove the adhesions that have already formed within the cavity. So we will need to use a combination of laparoscopic surgery and hysteroscopic surgery. So the most common cases that we do observe is that there's presence of adhesions in the pelvic cavity. Then we need to remove all of these one by one. Secondly is that adhesions forming within the fallopian tube. Now adhesions can be very severe, so severe that the entire fallopian tube has been blocked. So then we need to clear the adhesions and make sure that the fallopian tube is actually smoothly opened from end to end so that ovulation can occur. So once this is all these factors are treated properly, then ovulation can take place and pregnancy can be had. So this is quite a common factor that a lot of women are unaware of and only aware of until it's far too late. because if it's much more severe, the success rate of treatment is also vary according to severity. So we do want you to get regular screening, regular checkups, and avoid having multiple sexual partners. If you do have multiple sexual partners, practice safe sex, and also maintain proper hygiene. These are some precautions that we can do for ourselves. And if you have been diagnosed, not to worry, we do have laparoscopic surgeries and antibacterial antibiotics to help you remove the infection. If the underlying cause has been treated, pregnancy can be had, and miscarriages can be avoided. Antai Hospital offers these treatments with a full refund guarantee to ensure you have a successful pregnancy with no complications.